Okay, so first we will begin by scanning the room. And now we begin this assessment.
Come in.
Hi, my name is Laura. I'll be your nurse today. I'm just going to wash my hands and close the door for your privacy. And can you state your name and date of birth, please?
J. Johnson, 11/16/95.
And are you in any pain?
No.
Do you have any allergies?
No.
Okay, so patient looks stated age. Her hygiene is well kept. There's no foul odor or anything. Her mood seems appropriate for the occasion. And do you know where you are?
University of Detroit Mercy.
And what year is it?
2016.
Okay, so the patient is oriented ×3, and there's no obvious illness that I can see by her sitting here, so we're going to move on to the head. Do you mind if I touch your hair for a second? Okay. I am not noting any lesions or anything. The hair distribution is good, color is good, it's appropriate for ethnicity. Her skin color is appropriate for her ethnicity. I don't see any lesions or abnormal moles. If I did, I would do the ABCDE assessment tool to kind of figure that one out to see what they are. And now we'll move on to her eyes. Okay, so her pupils are equal and round bilaterally at 3 millimeters. And could you follow my pen light? And then just look straight at me. Okay. And her pupils are reactive to light and accommodation. And then do you mind if I touch your face?
Nope.
Okay. And then the conjunctiva is pink and moist. There's no lesions on the inside or anything. And then could I look in your mouth real quick? The mucosa is pink and moist. Her tongue is moist. It's midline. Could you say ah for me? Her uvula is midline. It's mobile. The tonsils are at a +1. I don't see any cavities or anything. The teeth are white. There doesn't seem to be any dental work. She has all 32 teeth. And I don't see any lesions or anything on the inside of the mouth. Could you puff your cheeks up for me? And could you smile? Cranial nerves 5 and 7 are intact, and now we'll move on to the carotid arteries. So I would palpate each one with one hand. Okay, so the carotid arteries are equal bilaterally at a +2. There's no bounding pulse or anything. The rhythm seems equal. And then could you hold your breath so I could listen real quick? Okay. So I didn't hear any bruise or anything. The rhythm is again normal at a 2+. And now we are going to move on to her brachial and radial pulses. So could you stick your arms out for me? Okay. Her brachial and radial pulses are equal bilaterally at a 2+. And could you stick your hands out like this? And could you grasp my fingers? Okay, her strength is equal bilaterally. One hand wasn't stronger than the other. Could you do this to check for clubbing? There's no clubbing of the fingers or nails at all. And then could I see your fingernails so I could check capillary refill? And then a capillary refill returns within 3 seconds. So now we are going to move on to your heart. And then I am going to listen at your aortic first, and then your pulmonic, and then your herbs, tricuspid, and then your mitral. Okay, so at the second intercostal space, I could hear her aortic heartbeat. It was an equal rhythm at her second intercostal space on the left side. I could hear her pulmonic, and then I could hear her herbs at the third intercostal space. And then I heard her tricuspid at the fourth intercostal space. And then on the fifth intercostal space, left midclavicular line, I could hear her mitral, and I would listen there for 30 seconds, or 60 seconds, not 30. And then I would go back up with the bell to listen one more time. And the heart rhythm is again equal at 2+ bilaterally. And then next we're going to listen to lung sounds. So I would do 10 spots, or 10 spots on posterior and anterior. Okay, take a deep breath. I didn't hear any adventitious sounds or anything like that. Would you mind turning around for me so I could see your posterior? Okay, perfect. Would you mind standing up for me real quick? Okay, and then I'm just going to test your kidneys for tenderness. Are they tender at all right now? Do you feel anything? Okay. And then, any tenderness?
No.
Any tenderness?
No.
Okay, would you mind bending forward slightly so I can test your spine? Okay, and then you can stand back up. There's no curvature or anything, so scoliosis is not present. You can sit back down. And then would you mind laying down so I could see your abdomen? Do you mind if I lift your shirt up? Okay. Okay, so the skin is even. I don't see any abnormalities, no moles that are abnormal, no lesions. Their stomach is not concave or anything. It's just flat. There's no curvature. I'm not seeing, again, there's no abnormalities. The belly button is midline. And then I'm just going to listen real quick. So, see your bowel sounds. Okay, no abnormal bowel sounds were heard. It wasn't hyperactive or hypoactive. And then I didn't hear any dullness or anything. So now I'm just going to percuss lightly. Let me know if you feel any pain at all. Okay. There's no tenderness or anything on the abdomen, and then there was, again, no dullness heard. So now I'm just going to palpate a little deeper to get a better feel. Okay. I didn't feel any abnormalities, no masses or anything, and again, there was no tenderness. And then the major organs in each quadrant, in the right upper quadrant, you have your liver and your gallbladder. In the right lower, you have your right ureter and then your right ovary. In the left upper, you have your stomach and you have your spleen. And then in the left lower, you have your sigmoid colon and your left ureter. You can sit back up as well. And then at a 45-degree angle, there was no JVD noted. So, okay, could you pull your legs up again? Okay, so the skin is even. There's no abnormal moles or masses again. The skin is correct for ethnicity. It's warm bilaterally. Again, there's nothing abnormal. If there was, I'd use the ABCDE assessment tool. And then if you could come forward so I could check your pulse. Okay. Okay, so the popliteal pulse is equal bilaterally at a 2+. And then let me check. The dorsalis pedis pulse is equal bilaterally at a 2+ as well. And then the tibial pulse is equal bilaterally at a 2+ as well. And there's no edema noted. If you wouldn't mind, after you pull your pants down, could you stand up? And then could you sit down? We're going to perform the get up and go test, so could you stand up real quick for me and then walk to that board and then walk back. And then there's balance is normal, there's no abnormal gait, she's not wobbling or anything. Would you be able to come right here and stand and just close your eyes so I can observe you? This is the Romberg test. Okay, the patient's not swaying, there's no dizziness, she's not falling over. You can open your eyes now. And you can sit down as well. So she's able to stand without falling over. Would you mind taking, no, I don't need to take your socks off. Okay, I'm going to perform the Babinski test. So I'm just going to go up, actually, let's use this. We're just going to go up, like just, it's not going to hurt, but just want to test if your feet curl or split apart. Okay. And there's no abnormal signs for that as well. I believe that completes my assessment.